Thank you very much. My name is Piero. Um, I've written a number of books on artificial intelligence. That has been my field since the 80s. So what have robots done for pandemics in general and this pandemic in particular? So this is this is Wuhan in January 2020. This is a picture that was shocking in January and then was repeated in Milan, Italy, New York, and so on. So what was that? The lockdown was the low-tech solution to dealing with the pandemic. And this pandemic has been a reality check for the world of automation. Clearly, we didn't automate in the right sectors. For example, shelves of toilet paper were empty. We have all these people in Silicon Valley talking about the singularity that is coming very soon. Actually, I think it was supposed to come this year. But then we don't have toilet paper in Silicon Valley. Deep learning systems have made news all over the world because they're so good at playing video games and even beating the world champion of Go, for those of you who have ever played Go. But they're mostly useless for discovering a treatment or developing a vaccine. They have not helped us at all. So for a long time, we've had this fear of artificial intelligence and the robots that are coming, and they could do devastating things to humanity. So the pandemic showed that during emergency, hospitals don't have enough medical personnel. Second, this personnel is at risk. Healthcare workers risk their lives. A lot of them died, including the famous Chinese doctor who was the first one to raise the alarm. So the futurists who like apocalyptic scenarios have created the vision of the wrong dystopia, a dystopia of robots that are everywhere, that are smarter than us, they control us. The real dystopia, which is coming very soon, and for real, is a future in which we don't have enough robots, and we don't have robots smart enough to handle the essential tasks when these tasks cannot be performed by human beings. So I think this pandemic could be an opportunity to accelerate the development of medical robot technologies. That's where we are very weak. Years ago, very famous, there was a DARPA Grand Challenge for self-driving vehicles. So I'm calling for a medical robotics challenge, maybe staged in a real hospital. I think in general, there was a collective lack of imagination. We had Hollywood movies with all sorts of robots. These are some of the most popular, but nobody ever made a movie about a hospital run by robots. So we mostly imagine pretty useless robots. In general, we've been planning all these smart cities. China in particular has more than 400 smart cities now. And all over the world, the cities are trying to get smarter and smarter. We forgot it has to be safe and it has to be resilient in case of a major crisis. So we should start thinking about safe and resilient smart cities. Let's not forget that when we build the cities and we make cities bigger and bigger, we increase the chances of a virus spreading very quickly. Because, precisely because of the nature of a city, mass transportation, and more crowded spaces. So these pictures are from 1919. The flu pandemic, the so-called Spanish flu that actually started in the United States. Spain is the first place where it came out. The first place where it shows up is not necessarily the place where the virus was born. anyway, 1919 was a good example. That's that was a time, besides being a time of crisis because of World War One, but it was a time when so many big cities had reached a high density of population. I mean, next, we are happy that Ebola, which is a lot deadlier than COVID, we are lucky that it originated in places where people don't travel much, and originally in villages. Unfortunately, the latest wave also reached towns, major cities, but it originated in villages in the jungle, in places with little international travel. But we have to prepare to the fact that Ebola or something like Ebola could travel to a major city. So what's a safe, a resilient, smart city? It's a biotech intensive city with a lot of automation. It has more hospitals. It has more automation in hospitals. It provides citizens with smartphone applications and wearables that can quickly detect infections. And it is equipped with service robots on demand for hospital chores and for assisting families at home. We need robots that can expand the hospitals quickly, robots that can replace nurses and doctors in hospitals, robots and drones to deliver food and medicines to people who cannot move from their home, robots to detect and neutralize biological organisms in buildings, and robots that can be programmed to take over in restaurants and shops. This has been a complete failure of artificial intelligence and robotics. Remember the Wuhan hospital that was built in 10 days? This made news of all over the world. In 10 days, they went from that picture to a real hospital. Well, who built the hospital? If you zoom on the pictures, it's people. People built the hospital, not robots. Now, there are success stories of robotics in healthcare, and the traditional one is surgical robots, the main one. But now we need that's the famous Da Vinci surgical robot used in many hospitals of the world. But now we need non-surgical medical robots. So that's the real story that we have to invent quickly. There are already, I mean, technology is there. There are already disinfecting robots. So these are some of the models that can be purchased. There are, of course, delivery robots. There's been so much hype about self-driving vehicles. The reality is not what the hype says, but still they exist. And when the streets are empty, by the way, these are more feasible than when the streets have a lot of traffic. We have robots for testing people, although I haven't seen them used in practice, but a couple of companies introduced them. Telemedicine has been possible for a while, and this pandemic forced a lot of doctors to start using it. And for example, Boston Dynamics adapted one of its robots to becoming a way of communication tool between doctor and patient. And then robotic assistants have existed also for a while. There are several on the market that some hospitals have been using it. They can do laboratory chores like loading and unloading devices, sorting test tubes, sort of routine jobs that right now take up a lot of time of nurses. And when nurses are super busy, this is time consuming, and it's a waste of time for badly needed nurses. Um, and I wanted to mention in particular this center in Houston that is, in a sense, it's the prototype of the robotic hospital. It's probably one of the most automated hospitals in the world. It has a cooperation with a company, ABB, that makes robots, and the robots are used intensively in this center. And so anyway, hospital assistance exists, not very widespread. One thing we learn is that we are actually not able to make face masks, respirators, and so on at scale, the scale we need when there is a pandemic. The machines exist. There is some of the machines that are available on the market. So I don't quite understand why it was so difficult to use them. And for producing pharmaceuticals, hopefully the big companies are coming out to speed, and now that we have the first treatments, and hopefully we'll have vaccines soon. A big topic would be the automation of drug discovery. This pandemic actually has shown us that biotech is very advanced. We had within a few weeks, we had the design of potential vaccines, and there are a number already in trial. Nonetheless, it would be nice if this could be done in days instead of months, and also how to identify potential treatments. It's a painful trial and error process right now. So a combination of machine learning, robotics, and biotech would be welcome. I mentioned Zymergen just because it's based near me, but there are many companies that are trying to combine them. A major company is coming up is a healthcare robotics, and I would be curious to see what gets presented there. By the way, again, talking about the apocalyptic views of technology, they're all justified, and we should be careful what we do with technology, what corporations and governments do with technology. But at the same time, there are advantages in using machines. A food delivery robot or a temperature measurement robot does not see the color of your skin and doesn't know how rich you are. The human who delivers a pizza or anything else to a neighborhood could be influenced by the kind of neighborhood. A robot is not influenced. A robot does exactly the same thing, whoever you are. And actually, a good example, the surgical robot. When a surgical robot performs an operation, it doesn't know who you are. So what we need really is more than just a few startups experimenting with these new technologies. What we need is national programs, in my opinion. And robotics R&D is still largely driven by government initiatives, at least in Asia and Europe. That's a recent report that can tell you more about this. But looking into the national programs, you don't get too excited. This is China's robot industry development plan. It has some goals very specific for 2020, very ambitious, achieve 45% of domestic market share for China's high-end robots, increase China's robot density to 100 robots per 10,000 workers, and so on. But it has very little about robots in healthcare. Korea has a basic plan for intelligent robots announced last year. And again, interesting plan, but no mention of the healthcare sector. Japan is actually the one that has invested more in the healthcare sector, perhaps because it has an older population. Its plan is 5 years old, the new robot strategy. but it has specifically a section on medical robots. The European Union has announced a Horizon 2020 program, but in reality, it's really a patchwork of national plans. Germany's pace is probably the one that is well funded, but again, very little, if anything, about medical robots. The USA, by the way, has the NRI 2.0 National Science Foundation project for robotics. Budget for 2019 is 35 million, which it's not enough even to buy face mask for everybody. It's a fraction of what we are spending for for this pandemic. So much of the technology exists. What is the problem? Well, first of all, robots have to be cheap enough to be mass produced. They have to be customizable because each region and each hospital is different. They have to be trainable, able to perform multiple tasks, just like nurses do. Ideally capable of learning from demonstration. Easy to operate, able to communicate in real time. For example, with the contact tracing application, they must have a positive long-term societal impact. So that's a call for a national program, but call also this could also have call for proposals from the industry, partnerships between the industry and academia, and international cooperation. And again, a yearly grant challenge where we can deploy them in a hospital and see who does best. We have to be prepared for the case when we don't have enough healthcare workers, and the robots have to take over. And think of developing countries. So many regions never have enough hospitals and enough healthcare workers, even when there is no pandemic. So it's not like if we invent this kind of robotic hospital is wasted unless there is a pandemic. There's lots of places where it would be useful right now. And of course, an international program. Let's imagine together the movie that Hollywood never made, the movie where a hospital is run by robots. Now, in my opinion, the mother of all problems, at least in the West, has been that from the beginning, we planned we planned only for the best case scenario. The virus will not spread, it will be just a flu, there will soon be a cure, there will soon be a vaccine, there will be no major other crisis. What happened in 1919 is instead a good lesson. The virus did spread everywhere. It was more than just a normal flu. There was no cure, there was no vaccine, and it started in the middle of World War I. Hopefully this one will not be so dramatic, but planning only for the best case scenario is not a good way to face the worst case scenario. And we are still planning for the best case scenario. So AI in particular has been spectacularly useless in this pandemic. With all the hype that came after the introduction of deep learning in the 2010s, the first major crisis that the world has faced was a crisis that relied on humans, on doctors, nurses, scientists, and construction workers. The contribution of AI is really very minimal. I can name a team in Taiwan that has synthesized probably the first antibodies for developing test kits. Graphene is a startup that helps map the evolution of the strains Of course, China used reused recycled face recognition to identify people who are not wearing face masks. Data analysis, they talk a lot, now they call everything machine learning, but mostly the data analysis that we're using relies on traditional algorithms and seems to have learned very little. If you like me, you check the numbers on the popular websites, all you see is just a list of countries and how many people died, how many people are infected. And then you do a division, they divide by the population, and you obtain a death rate. I don't consider this particularly intelligent. And of course, where should we invest? Whether you call it AI or not AI, somebody has to learn more about viruses and about the immune system. If you talk with virologists and epidemiologists and ask them questions, it's incredible how many questions have a simple answer. I don't know. We just don't know enough. Why are children immune to this virus? Why some young, healthy people die, but most young, healthy people don't even get sick? Under which circumstances does a virus jump from an animal to a human being? Most of the deadly viruses, the dangerous viruses, are zoonotic. They come from animals. Why and how does that happen? Bats seems to be particularly efficient at transmitting bad viruses to humans. Why bats? And why they don't get sick? They don't die of these viruses. Why the bats of Yunnan didn't die of COVID? What can strengthen our immune system? You'd imagine that by now we would have found a scientific agreement on what is good for the immune system. So where I come from, people think oranges, eat a lot of oranges. There's no scientific evidence. I think the only scientific studies that show a correlation between lifestyle and the immune system say that you should sleep and sleep well and exercise. Thank you. We knew that. How do viruses mutate? Why they still exist? Why there are so many of them around? Are they all bad, or some of them are good? I read some books that show that viruses are actually essential for our survival. That's very interesting. So this whole thing needs, maybe we need more biologists and fewer computer scientists. Okay, that's the end for now. I'm a realist, not necessarily a pessimist. I look at what's out there, and artificial intelligence and robotics has mostly failed to help in this pandemic, especially if you consider how much companies and governments have invested in artificial intelligence. Okay, thank you.